You were born to learn to communicate, whether it is verbal or nonverbal. You learned your first communication cues from your parents. For some, it doesn't come easy. You can be born deaf, blind, or have speech impairments. For some, it will affect their childhood. In this presentation, I will discuss about the predictions of speech and language disorders, deciphering the genetics basis, and the question that everyone is asking. Does speech and language disorders affect your everyday learning? First, I will talk about the prediction of speech and language disorders. Are there signs that you will be able to tell if your child will have these disorders? During the stage of infant babbling, infants produce syllables such as baba, dada, and mama. Nearly all infants with normal hearing begin this stage by 10 months of age. A few of these may be delayed, and those infants may be of special interest. Recent studies indicate that the late onset of babbling may be a predictor of speech and language disorders. A simple screening procedure that focuses on babbling was used to evaluate over 3,000 infants who were at risk at the age of 10 months. The infants who showed late onset of babbling, fewer than half who had been previously diagnosed as having a significant medical condition that may be accounted for the delay. A follow-up study showed that infants with the delayed babbling had smaller vocab at 18, 24, and 30 months. The results suggest that the late onset of babbling can be a factor, and it can be monitored effectively through an interview with a parent can predict delay in the onset of speech production. Next, I will talk about the deciphering the genetic basis of speech and language disorders. Does genetics play a part of these disorders? Recent findings suggest a genetic susceptibility for speech and language disorders. Developmental speech and language disorders cover a wide range of childhood conditions with overlapping but heterogeneous phenotypes and underlying etiologies. This characteristics hinders accurate diagnosis, can complicate treatment strategies, and cause difficulties in the identification of causal factors. Over the last 10 years, genetic variants have been identified that may be predispose certain individuals to different aspects of speech and language difficulties. The advances in the genetic investigation of stuttering, speech, sound disorders, language impairment, and verbal dyspraxia, the identification and study of specific genes and pathways, including FOXP2, CNTNAP2, ATP2C2, and enzymes, may advance our understanding of the etiology of speech and language disorders and enable us to better understand the relationship between the different forms of impairment across the spectrum. Now I will talk about how do speech and language disorders affect learning. Do speech and language disorders affect your everyday learning? When children experience a speech and language disorder, their learning may be affected. A child diagnosed with this disorder will have difficulty understanding and processing verbal information. When the information is presented of something for the child to remember, it can be difficult for them to understand what was said or remember the information or instructions correctly. Children who have speech and language disorders may also have problems with learning to read or spell. Research has shown that verbal skills are very influential in developing reading skills. Children who have difficulty with verbal production need to be able to associate sounds with letters and then segment those apart in order to successfully learn to read and spell. This skill can be especially hard for children who struggle with speech and language disorders. Therefore, we can conclude that speech and language are more of a common occurrence than you think. As many as 5% of children of school-age children will have a language disorder, and this makes speech and language disorders more common for childhood disorders. Of the 6.1 million children with disabilities who received special education under IDEA in public schools, more than 1.1 million were served under the category of speech and language impairment. In summary, I have covered the following topics in speech and language disorders: the prediction of speech and language disorders, deciphering the genetics of speech and language disorders, how do speech and language disorders affect everyday learning, and just how common speech and language disorders are. Now, having a better understanding on these types of disorders, you can have a better realization of how something you do so easily might not be easy for everyone. No, you have to walk through again.